joining us on BT Vancouver. An organization that represents the long-term care sector in BC is looking at recruiting people laid off from the hospitality sector to help solve a staffing shortage. Joining us now to continue the conversation this morning is seniors advocate from CanAge, Laura Tamlin-Watts. Hi, Laura. Thanks so much for joining us. Great to see you.
A pleasure.
So you have been making public calls for reform in the long-term care sector. The BC Care Providers Association, they want to target people who have been laid off to fill some of the holes in these care homes. Do you think this is a good step forward in your professional opinion?
I think what's important as well is to match where capacity exists, where we need capacity. And one of the areas that we really do need to draw from is, I think, this particular hospitality sector. We need to help to transform the model of long-term care away from just a health model and into more of a hospitality model. Now, that doesn't take away from their need for training. There's no question. And it depends, of course, on the training to what type of job that person would have. But there's lots of jobs in long-term care, in catering, in service delivery, and so on. And I think the hospitality sector would be well placed to support that.
So we know the long-term care sector, unfortunately, they have been negatively impacted throughout this whole pandemic. We know the workers aren't making enough money as they should be. So how do we attract people to work in this line of work and retain them?
You know, we've already looked at how Quebec has done it, which is to promise them very well-paying jobs, sort of $50,000 a year plus pensions and benefits, and only working in one location. And I think as we're moving forward in British Columbia, we need to also be thinking about well-paid salary jobs, pensions and benefits, and also trying to make sure that they have not just a living wage, but that they can stay in one home and not have to travel between. So the fixes are possible. We just need to do them.
So when you look at the long-term care sector across Canada compared to where we were a few months ago, I think you joined us in April, are you starting to see some positive trends in Canada? Are you optimistic that things are starting to get better?
I am optimistic because still right now the question of long-term care is in the focus of everyone's minds. What I'm worried about is as our pandemic starts to wane in the general population, will eyes be turned away from long-term care as it so routinely does? So right now there is a focus, there is a momentum, and there's really worries about a second wave coming. But can we target that energy and put those shovel-ready projects into the ground that we know that we need to do to make really significant change? So optimistic, but cautiously so.
So what is critical to get them help right now? What do we need to do right now so we don't lose focus?
We need to make sure that when we're thinking about long-term care, we're thinking about all of seniors' care, not just somewhere that's hidden away. So we need to be thinking about the entire continuum of care. How do we support people to stay at home longer? And home care is part of that solution. How do we make sure that we build that staffing capacity? And this creative idea from the BC Care Providers is part of that solution. And then how do we make sure that we work increasing the amount of long-term care that we have available? So that's a job for government, BC Housing, and the associations like the BC Care Providers to come together and involve new land grants and build new projects, but build them in smaller homes like dementia villages, not big institutions. So there's an opportunity. I just hope that we move forward.
Laura, we are out of time. Thank you so much again for joining us this morning and sharing your expertise as you always do.
Thank you so much.
That is Laura Tamlin-Watts. She's with CanAge, the National Seniors Advocacy Association. 7:50 now on Breakfast Television.